Here are the lumbar vertebrae, the pelvis, and the two femurs. We'll look at the pelvis by itself. The pelvis is made up of the two hip bones, or innominate bones, and the sacrum. The fibrous joints which unite them, the two sacroiliac joints behind, and the pubic symphysis in front, permit almost no movement. We look at the right hip bone by itself. The hip bone is formed by the fusion of three bones: the ilium, the ischium, and the pubis. The names of these bones give rise to the names of the various features of the hip bone. Let's look at these features. This broad bony plate is the wing or ala of the ilium. Its broad roughened edge is the iliac crest, an area where many important muscles attach. The iliac crest ends in front at the anterior superior iliac spine, and behind at the posterior superior iliac spine. This is the ischial spine, with the greater sciatic notch above it and the lesser sciatic notch below it. This is the ischial tuberosity. The ischial tuberosity is another area where many muscles attach. It's also the part of the hip bone that we sit on. The socket for the hip joint is called the acetabulum. This broad, smooth area is the articular surface. We'll see it again in a minute with the articular cartilage intact. The big hole in the lower part of the hip bone is the obturator foramen. This is the body of the pubis. This is the superior ramus of the pubis, and this is the ischiopubic ramus. This prominence is the pubic tubercle, to which the inguinal ligament is attached. When we look at the hip bone from in front, like this, we see the inner aspect of the ilium and the outer aspect of the pubis and ischium. Now that we've looked at the hip bone, let's bring the sacrum back into the picture. We're looking at the bones as they'd be in the upright standing position, and it's perhaps surprising to see the angle at which the sacrum lies. Its pelvic surface is more nearly horizontal than vertical. The sacrum is attached to the hip bone not only by the sacroiliac joint, seen here from behind, but also by two big ligaments, one going to the ischial spine and one going to the ischial tuberosity, as we'll see in a minute. Now let's add the femur to the picture. The femur is the longest bone in the body. We'll be looking at its distal end in the next section. For now, let's look at the features of the proximal end. This is the head of the femur. This is the neck. Since the head is wide and the neck is narrow, the head of the femur can go a long way in this axis and in this axis before bone hits bone. This prominent lump is the greater trochanter, and this one is the lesser trochanter. The greater and lesser trochanters are important muscle insertions. This line, the intertrochanteric line, marks the insertion of a major ligament of the hip joint, which we'll see in a minute. On the back of the femur, this prominent ridge, the intertrochanteric crest, runs from the greater to the lesser trochanter. This broad rough area is the gluteal tuberosity. This rough line running down the shaft of the femur is the linea aspera. Many muscles have their origins or their insertions on the linea aspera, on the gluteal tuberosity, and in this hollow in front of the intertrochanteric crest. We saw the proximal end of the femur in the last section. Now let's look at the distal end. The two smoothly curved surfaces are the lateral condyle and the medial condyle. The deep notch which separates them is the intercondylar notch. Above the two condyles are the epicondyles, lateral and medial. The sharp corner on the medial epicondyle is the adductor tubercle. This prominent ridge is the medial supracondylar line. This one is the lateral supracondylar line. There's one more bone to add to the picture, the patella, or kneecap. The patella, as we'll see, is embedded within the quadriceps tendon, which comes from up here and inserts on the tibia down here on the tibial tubercle. On the back of the patella, the articular surface is divided into facets. These articulate either with the femoral condyles when the knee is flexed, or with this central articular area when it's extended. Now we'll add the tibia and the fibula to the picture. The tibia and the fibula are fixed to each other firmly by two joints, the proximal and distal tibiofibular joints. There's almost no movement at either of these joints. Let's take a look at the proximal end of the tibia. This is the medial condyle. This is the lateral condyle. On top of the two condyles are two quite separate articular surfaces. They're much flatter than those on the femur. The rugged expanse between the articular surfaces is the interarticular area. This prominent lump on the front, the tibial tubercle, is the final insertion of the quadriceps tendon. The small facet under here is for the fibula, which we'll add. This is the head of the fibula. This is the neck. The head of the fibula is the point of attachment of a major ligament of the knee joint, as we'll see. The leg, the tibia, and the fibula. The tibia is much the larger of the two bones. The shafts of the two bones are covered by muscles, except for the anteromedial aspect of the tibia, which lies directly beneath the skin, all the way from the knee to the ankle. The proximal end of the fibula doesn't form part of the knee joint, but its distal end forms an important part of the ankle joint, as we'll see. The tibia and fibula are held together throughout their length by the strong interosseous membrane. Above and below, they're attached at the two tibiofibular joints. The proximal tibiofibular joint is a synovial joint. The distal one is a fibrous joint. There's very little movement at either of these joints. Distally, the two bones are strongly held together by the anterior tibiofibular ligament and the posterior tibiofibular ligament. The projecting ends of the tibia and fibula, which stick out on either side of the ankle, are called the medial malleolus and the lateral malleolus. This is the talus. The bone below and behind it is the calcaneus, or heel bone. The bone in front of the talus is the navicular bone. We'll meet the other tarsal bones shortly. Now we'll go round to the lateral view to see the talus by itself. This is the head of the talus. This is the neck. We already know the talus, the calcaneus, and the navicular. In front of the navicular are the three cuneiform bones, first, second, and third. Lastly, the bone in front of the calcaneus is the cuboid bone. Now let's look at the calcaneus by itself. The posterior part of the calcaneus forms the heel. The massive calcaneal tendon, also called the Achilles tendon, is attached here. Here on the medial side there's a projecting shelf which the medial part of the talus sits on, called the sustentaculum tali. Here's the calcaneus, the talus, the navicular, the cuneiforms, first, second, and third, and the cuboid. Let's see the same bones again from beneath: the calcaneus, the cuboid, the cuneiforms, the navicular, and the talus again. Now we'll look at the metatarsals. Like the toes, the metatarsals are numbered 1 through 5. The first metatarsal is more massive than the others. The second metatarsal is the longest. On the base of the fifth metatarsal, there's a prominent tubercle. The metatarsals are slightly curved from end to end. The heads of the metatarsals lie in one flat plane, but their bases form an arch from side to side, as do the tarsal bones that they articulate with. These are the 3 cuneiform bones and the cuboid. These are the tarso-metatarsal joints. There's very little movement at any of them. The bones of the foot are arched in 2 planes, from side to side, as we've just seen, and also from end to end. The big toe has only 2 phalanges, a proximal and a distal. The other 4 toes have 3 phalanges, proximal, middle, and distal. These are the metatarsophalangeal joints, or MP joints for short. The joints between the phalanges are the interphalangeal joints.